Good morning, everyone. My name is Nisha Kandel, and my student ID is 22106 Today, I will present a case study of Joran, a 5-year-old Aboriginal boy from a remote Northern Territory community who was admitted to Metropolitan Hospital with an acute exacerbation of asthma. He was presented with severe wheezing, shortness of breath, and oxygen desaturation, where his condition was complicated by cultural and linguistic barriers, as his mother speaks limited English and primarily communicating in Enlu Mata as her first language. His father, a respected elder in community, was unable to stay with his family, which makes Joran and his mother feel isolated and disoriented to the hospital setting. Before presenting the case study, I would like to share the definition of cultural safety, as it is very important to know about. Cultural safety refers to ensuring individual, regardless of culture, background, sexual orientation, occupation, or socioeconomic status, who receive secure, individualized care in an environment where they feel safe and respected. Cultural safety in nursing should address patient cultural and individual needs to support and enhance positive therapeutic connections while safely meeting their health needs without demeaning, or disempowering them. In this presentation, I will cover three key areas: how culturally safe healthcare promotes health and well-being in children, adolescents, and their families who are from culturally diverse background, threats and support for the implementation of culturally safe healthcare in this case, professional colleagues and their roles in ensuring culturally safe healthcare. Promoting the health and well-being through culturally safe healthcare. Culturally safe healthcare means ability to understand and work with diverse cultural groups, which directly improves health outcomes of children, adolescents, and their families through providing patient-centered care that respects and reflects their unique health beliefs, practices, and value systems. It can be promoted by involving families in communication and decision making about treatment and management of their children's condition to the extent where they feel comfortable while ensuring their cultural values are respected. This also involves prioritizing cultural perspectives in the planning and provision of care, such as acknowledging the significant role of elders in family decision making and building trust by recognizing the family's sense of isolation in an unfamiliar hospital environment. In addition, arranging a professional interpreter is a vital to address language barriers for culturally diverse background, which help to make sure that family clearly understand treatment plans, medications, and discharge instructions, which empowers them to confidently support their child during the time of treatment. Therefore, culturally safe healthcare can be promoted through involvement of families from culturally diverse background in decision making, which empowers them, builds trust, and leads to better health outcomes for children. Threats and supports to implement culturally safe healthcare. Threatening factors in Joran's case. In Joran's case, several factors threaten the delivery of culturally safe healthcare. The most immediate threat is the language barrier, as Joran's mother primarily communicates in Enlumata, which places her at risk of misunderstanding complex medical instructions and limit her ability to participate fully in decision making, as well as the family's geographical displacement from their Northern Territory community to a metropolitan hospital also causes emotional distress and disconnection from country, compounding their sense of isolation. These experiences reflect broader inequities affecting Aboriginal and Torres Strait Islander peoples who face a higher burden of chronic disease, shorter life expectancy, and reduced healthcare access due to the enduring effects of colonization, systemic racism, and discrimination. Additionally, lack of coordination of healthcare services in regional and remote areas, where poor communication in communities and families often lead to unaware of visiting specialist services, leading to inconsistency and underservicing, which create frustration for both healthcare providers and Aboriginal families. Furthermore, the fear of racism, judgment, and disrespect discourages Aboriginal people from seeking mainstream healthcare services. Therefore, for Joran and his mother, these combined barriers such as language barrier, cultural disconnection, service coordination gap, and fear of discrimination threaten their ability to feel safe, respected, and supported in the hospital environment, which directly impact Joran's immediate asthma management and the family's ongoing engagement in safe healthcare delivery. Similarly, supporting factors for culturally safe healthcare. In Joran case, culturally safe healthcare can be supported through several key strategies such as community engagement and co-design, in which Aboriginal families and communities are actively involved in planning and decision making to ensure that the care provided reflects the cultural values and perspective. For example, recognizing Joran's father's role as an elder even in his absence, respects kinship structures, and supports family involvement. Building trusting and accountable relationship between the healthcare professional and Joran's mothers also helps reduce her sense of isolation in the Metropolitan Hospital, which allows her to feel more comfortable and supported during her son's admission. In addition, healthcare professionals must also show cultural integrity and competence by reflecting on their own biases and adjusting the way they communicate and provide care, so that every interaction is fair and respectful, which is particularly important when explaining treatment plans to ensure his mother feels listened and respected, also included in his care. Moreover, the use of language protocols is another important factor, as arranging a Anlu Mata interpreter or Aboriginal liaison officer that allows his mother to clearly understand Joran's treatment and discharge plans, empowering her to take as an active role in his care. Finally, ensuring that Joran's healthcare delivers tangible benefits for his family and community, such as continuity of care through local Aboriginal community control health service that strengthens trust in health system and supports ongoing safe practices. Therefore, these factors create a healthcare environment where Joran's asthma management is effective while his family's cultural identity and traditions are fully respected and valued. Furthermore, professional colleagues to implement culturally safe healthcare. Culturally safe healthcare for Jorans require the involvement of multiple professional colleagues working alongside with nurses in the hospital. Aboriginal healthcare workers and liaison officers are central to this case, as they act as cultural advocates, support communication between the family and staff, assist with admission, treatment, discharge planning, and linking patient to community services, ensuring that healthcare is delivered in more culturally respectful and sensitive manner throughout the healthcare journey. To address the language barrier, the involvement of professional and Lumata interpreter is important, as this allows Joran's mother to understand about treatment plans for her son's condition and ask questions. Also helps nurses to explain everything about Joran to mother in a respectful way. Involvement of social worker can address the practical and emotional challenges faced by the family, such as their isolation in an unfamiliar city, accommodation needs, or financial stress. Also advocating for culturally respectful discharge planning. In addition, a child life therapy implementation during hospital stay can support Joran directly, helping him to reduce pain, stress, fear, and anxiety through play-based and non-pharmacological intervention to prepare children for treatments, and by working with families which promote coping strategies that support better long-term outcomes in respectful ways. Furthermore, collaboration with general practitioner and Aboriginal community control health services is essential to maintain continuity of care, ensure follow-up, and support long-term asthma management within a familiar cultural environment. Overall collaboration with these professional colleagues, nurse can prepare the care plan, provide holistic, family center, and culturally safe healthcare environment that empowers families and improve outcomes for children. In conclusion, Zoran's case highlights the importance of culturally safe healthcare in ensuring positive outcomes for Aboriginal children and their families. By respecting their cultural values, addressing language barriers through the use of interpreters, and acknowledging the role of family and elders in decision making, as well as healthcare providers, creating an environment where family feel safe, respected and involved. The involvement of Aboriginal liaison officers, social workers, child life therapists and other interdisciplinary colleagues is also important in reducing isolation and building trust in an unfamiliar setting. Also to provide care that not only treats medical condition but also protects and strengthens cultural identity. All the references used throughout this presentation has been included in my script. Thank you so much for your time. I really appreciate it.